Hello students, welcome to Pharma Friday and I am Dr. Ankit Kumar. So the drug of the day is vancomycin. So sir, vancomycin is a glycopeptide group of antibiotic, and because of this reason, if we can remember glyco word, it inhibits trans-glycosylase enzyme inside the bacteria. Now this trans-glycosylase enzyme is required for synthesis of cell wall. Hence, vancomycin is a cell wall synthesis inhibitor. Now, vancomycin is only given for gram-positive bacteria. It is not effective against gram-negative bacteria. The reason is vancomycin cannot enter into the cell wall of a gram-negative bacteria. And this vancomycin, hence, is a very effective drug, which is a bactericidal drug. So if we go more detail into how vancomycin inhibits cell wall, remember on cell wall there is D-alanine, and vancomycin attaches on this D-alanine moiety of cell wall, and then it inhibits trans-glycosylase enzyme. Hence, cell wall is inhibited by vancomycin. Now, how does a bacteria become resistant to vancomycin? This D-alanine moiety becomes changed. It gets converted into D-alanine D-lactose in a bacteria. Hence, vancomycin cannot bind to D-alanine D-lactose, and this leads to resistance in a bacteria. Now, what are the uses of vancomycin? Remember, vancomycin is a highly polar drug or water-soluble drug. So when you give it orally, it will not be absorbed into the GIT. Hence, vancomycin is given for systemic infection as an intravenous drug. Intravenous vancomycin, it is the drug of choice for MRSA, that is methicillin-resistant Staphylococcus aureus. It is also the drug of choice for enterococcal endocarditis and all other serious gram-positive infection. But as we know that vancomycin, when given orally, it will not be absorbed through our GIT. But don't you think that this oral vancomycin will kill gram-positive bacteria locally in our GIT? Yes, that is why oral vancomycin is the drug of choice for one bacteria which colonize in our intestine, that is Clostridium difficile bacteria. Oral vancomycin is a drug of choice for the treatment of Clostridium difficile infection. Clostridium difficile infection causes pseudomembranous colitis. It is still the drug of choice in India, but yes, in America, the infection pseudomembranous colitis, we have a better drug known as fidaxomicin, which is not available in India. Now, what are the adverse effects of vancomycin? Adverse effects of vancomycin are similar to aminoglycosides. So, the first side effect of vancomycin is ototoxicity. Second side effect is nephrotoxicity. And the third characteristic side effect of vancomycin is red man syndrome. Now, what is this red man syndrome? The skin, the whole body becomes red. Why? Because vancomycin, when given as a very fast IV infusion, leads to massive histamine release from mast cell. And this histamine causes vasodilation and rashes. Hence, the person appears red. So, to prevent this red man syndrome, vancomycin should be given as a slow IV infusion, not as a fast IV infusion. Now, vancomycin, when we are giving in our patient, vancomycin requires monitoring. Why we do monitoring of any drug? Because monitoring will help us to know the chances of development of resistance. If the level of antibiotic is very less, the bacteria can become resistant. But if the level of this antibiotic is very high, there will be toxicity to this antibiotic. Hence, vancomycin requires monitoring to reduce the emergence of resistance and to reduce the toxicity of vancomycin. Now, how we do vancomycin monitoring? So, when we give vancomycin, vancomycin comes like this in blood, like a triangle, and then it falls. So, this whole triangle is known as area under curve. So, this area under curve of vancomycin is the best measurement of vancomycin monitoring. But it is very difficult to do. So what we do, students, when we give vancomycin, it increases, then it reduces. When it reduces at the last point, we call it as vancomycin trough concentration. So most convenient method is vancomycin trough concentration measurement. So this is how we do vancomycin monitoring. And vancomycin monitoring is done by measuring trough concentration using a graph. That graph is known as Duke University nomogram. So if we see Duke University nomogram, the patient vancomycin dose is on y-axis and creatinine clearance, which tells us about how much vancomycin is excreted out in urine, is on x-axis. And in between we have a straight line. So vancomycin dose should be above this line. This is known as Duke University nomogram, and the ideal trough concentration of vancomycin with time should be between 15 to 20 microgram per ml. So this is a very frequently asked question. Duke University nomogram and ideal trough concentration. But what should be the ideal AUC level, area under curve level? That is more than 400 milligram into R per liter. And this can be calculated by a very complex formula known as Bayesian AUC. AUC is area under curve calculator. So this is all about vancomycin, which can be asked from you people. So till then, pill learning.